Biosecurity can be defined as the set of measures aimed at preventing the introduction and/or spread of harmful organisms in order to minimize the risk of transmission of infectious diseases to people, animals, and plants caused by viruses, bacteria, and other microorganisms. We're going to talk about how to recognize some of the early signs of the most common diseases within the UK and the measures that are recommended for different types of situations. Biosecurity is the key to prevent certain microorganisms from entering our premises and spreading to our horses. It is therefore not only aimed to keep our yard free of infectious diseases, but to prevent the spread within the UK. We're going to talk about 4 main scenarios on which biosecurity measures need to be considered. We're going to talk about what to do on the day-to-day running of the yard. We're going to talk about the horses that live within the premises but are traveling in and outside the yard. We're also going to talk about those horses that they are arriving new to the yard, that are new to the yard. And also we're going to talk about what measures need to be implemented or are recommended in the case of an outbreak. It is worth start by making a list of things that we might need later on when we talk about the specific of those biosecurity measures that we're going to need to implement in our yards. The use of sanitizers are very important in order to avoid indirect contact in between horses. We will define later on what do we mean by indirect contact or the different types of transmissions. The use of thermometers are very important because we know that some infectious diseases can cause what we call pyrexia or fever, which allow us to detect those horses that have potential infectious diseases just by obtaining the horse's rectal temperature. We know that the normal range of temperature for an adult horse is between 37.5 and 38.5 degrees Celsius. It is important to avoid cross-contamination or indirect contact between horses, that each horse should have their own labeled feeds, bucket, and grooming kit. For this reason, it's very important that visiting horses should not have access to communal water troughs. As we will discuss later on, it is highly recommended to have an isolation box with separate equipment where we could potentially store these new horses or new arrivals and all of those horses that we will classify later as a high risk. The use of foot tips is recommended for preventing external contamination and is an essential equipment when handling an outbreak. In the event of an outbreak, it is mandatory to determine a person responsible to handle with the outbreak. It is important to establish this person because he will be responsible to determine which rules and which measures and how to apply them in the case of an outbreak when we're dealing with several owners and horses at the same time. With the use of these materials, we will prevent some of the different ways of transmission. But what are the different ways of transmission? Today we're going to talk about 3 main ways of transmission for equine diseases. The first one is direct contact between horses, on which an infected horse that is actively shedding the disease touches another horse. Diseases such as flu, HV, strangles, and ringworm can transmit this way. The second way is through airborne. This transmission is based on the survival of the disease in the water droplets suspended in the air. It can be short distance like EHV or it can be long distance like flu. The last way of transmission is through indirect contact or fomites. This happens when a horse that has an infectious disease transmits it to another horse through the tack or a person that has been in direct contact with both horses. Most diseases in horses can spread this way, but it doesn't necessarily need to be only the tack or another person. It can be the water, flies, any environmental contamination, or fecal oral spread, as in through the feces. The most common highly infectious diseases in the UK are flu or equine influenza, EHV, equine herpes virus, and strangles. Although these are the most common highly infectious diseases within the UK, we need to take under consideration that when traveling abroad with a horse, all the diseases need to be taken under consideration. Speak to your veterinary surgeon about your plans traveling abroad with your horse in order to get the best advice on how to prevent them and the vaccinations required to do so. Generally speaking, most infectious diseases will cause a series of symptoms that are key to identify them early and prevent an outbreak. They don't necessarily need to be all present or appear at the same time. Some of the diseases may cause the horse to cough. For example, flu is one of the main clinical signs that they show. Some horses will present with nasal discharge, in most cases a bilateral nasal discharge. This means that the discharge will come from both nostrils. This is often present in cases of strangles. Sometimes our horses will show no interest or very little interest on the feed, and they appear to be quite lethargic. Some cases will develop large lymph nodes, especially those around the lower jaw or the throat area, like it is in the case of strangles. As we previously discussed, the presence of high temperature, pyrexia, or fever, which is considered any temperature above 38.5 degrees Celsius, is often present in most of these infectious diseases, and this is the reason why it is very important to monitor the rectal temperature twice daily when dealing with an outbreak. Some of the infectious diseases like EHV will cause abortions, especially on those during the late term. And some of the diseases like ringworm may cause skin lesions, in particular focal hair loss around the face and neck. Sometimes the presence of diarrhea is itself suggestive of the presence of an infectious disease. The best way to have good biosecurity measures is not only apply them in case of an outbreak, but on a day-to-day basis. Every horse in the yard should be vaccinated and wormed. Every stable and horses transport should be disinfected in between horses. People in the yard should wash their hands often, especially between being in contact with different horses. For the same reason, it's also very important to not share the kit, or at least without previously disinfecting it properly. Routine temperature checks are particularly important with the new arrivals at the yard. If you have any concern, always seek veterinary advice. From a biosecurity point of view, the traveling horse is any horse which travels to and from the yard to anywhere where the horse may mix with others. This includes competitions, lessons, fun rides, hiking, or any trail hunting. Biosecurity measures can be broken down into 3 steps: actions taken at home before traveling or attending an event, actions taken whilst away from the yard at the event, and actions taken when returning home from an event. First, when the horse is still at home, before we traveling away, ensure that your horse's vaccination are up to date, not only with the vaccinations recommended for the country of origin, but also from the country of arrival. Always seek veterinary advice in order to make this possible. In order to prevent from spreading disease, do not take a horse to the event or move them off the yard if an infectious disease is suspected or diagnosed. As even the horses that may appear to be healthy may be incubating the disease. If you suspect that your horse may have an infectious disease, make sure all the owners on the yard are aware of this, as well as your yard manager, in order to seek veterinary advice immediately. It is important to be aware that we all have a shared responsibility to prevent the disease transmission, and this is only possible by ensuring all owners on a premise are informed when a disease outbreak is suspected. On yards where all the vets may visit, such as from different practices, make sure that they are made aware of any horses in the yard that they are off color, not quite right. This will allow the disease outbreak to be identified more rapidly. A very good example of this is the recent EHV outbreak in Hampshire, where several vets from different practices were already treating different horses that they were off color or not quite right, unaware that they were already all the horses in the same yard showing similar clinical signs, and they only became aware of these when the neurological signs started to appear. Whilst attending an event, it is important to not share any buckets, equipment, or tag. We always recommend to avoid nose-to-nose or any close contact in between horses. It is always recommended a good hand hygiene in order to prevent any indirect transmission. We always recommend to take your own water supply to events if possible. We can think of social distance as the key to biosecurity for horses, the same way that we recently started to apply it to people. When returning from an event, it is important to monitor your horse for any of the signs previously described. Horses that have attended an event where they might have been exposed to an infectious disease should be isolated or at least put in quarantine so that they cannot act as a source of infection to other horses in the yard. Any isolation or quarantine should be for at least 2 weeks to allow any acquired infections to show their clinical signs. It is important to have in place good biosecurity measures for those new arrivals or horses that are new to the yard. These horses need to be put in isolation for 2 weeks on arrival. The principle is the same as we were saying when returning from an event. It is to allow those diseases that might be present but might not be showing any clinical signs to do so. And for this reason, it is very important that during these 2 weeks, these horses have no contact with any of the resident horses. It is important to be very strict about the 2 weeks, since the horses might have obtained this infectious disease during the transit and not only during the event that they attended. In order to make isolation possible, it is important to have access to full isolation facilities. This will include separate personnel and equipment during those 2 weeks. It is also important to monitor the rectal temperature, as we previously said, twice daily on these new arrivals horses. We will have as well to monitor for the signs of infectious diseases, and all new arrivals should be up to date with the flu vaccinations before arrival, or at least 1 week after the second vaccination, if the whole course hasn't been finished. It is highly recommended that every horse gets pre-tested for strangles before moving. This is because we know that some of the horses that can shed the disease may not show any clinical signs whatsoever, even with 14 days of quarantine. For this reason, we would also recommend to test at the end of the quarantine before exposing all the horses in the yard to be in direct or indirect contact with this new arrival. It is also recommended to ask for a neck count and a tapeworm saliva test before arrival. But this is something that can be discussed with the vet as it might change between yards. The minimum requirements for isolation facilities for new arrivals of horses with clinical signs of infectious disease, as we previously described, is to have a separate stable that is not routinely used, that is at least 10 meters away from other stables, but at the end of the day, the vet, we usually recommend at least 25 meters from the nearest stable. If a stable is not available, then alternatively, we could set up an isolation pen that can be made in the paddock away from the yard. As we previously described, in order to avoid indirect contact, every isolation facility should have their own specific set of equipment, such as a wheelbarrow, hay nets, and separate mud heap. Even the areas to be used for disinfection, such as hand washing facilities and foot tips, should be separate from the ones in our normal yard. Isolated horses should be attended by an individual that has no contact with other horses. When this is not possible, they should be attended as a last thing during the day in order to avoid the cross-contamination within the rest of the horses of the yard. If we suspect an outbreak, the first thing to do is always seek veterinary advice as soon as possible. It is important to isolate any horses with temperature or that are showing any of the clinical signs previously described. In order to do so, please contact your yard manager in order to ensure that this movement of the horses are going to be done safely without putting other horses at risk. It is important to monitor rectal temperatures, not only of the suspected horses, but also the horses that may have been in direct contact or indirect contact with our horse. The temperatures we previously said, it is recommended to be taken twice daily. It is important to ensure that any vets coming into the yard are aware of any possible infectious disease, especially since veterinary surgeons are often moving in between different yards and may become a source of infection in between different yards. Setting up food dips and hand washing stations may facilitate the prevention from indirect transmission. It is also fundamental to stop any movement on and off the yard once an outbreak has been confirmed, or at least when it's suspected. In most of the outbreaks, it would be recommended to separate the horses in the yard in 3 different groups of categories. The first one is the red category, is for those horses that are considered infected, that they either have clinical signs or they have already tested positive. The second, it will be the yellow, or considered high risk, and is for those horses that have been in close contact and are therefore at high risk of developing the disease, but have not yet developed any clinical signs or are pending the results. And then we have the green category, and this is for the horses that have never been in contact, or either direct or indirectly, and or have already been tested and they have tested negative, and therefore are free of the disease. To summarize, the risk of infectious diseases can be minimized with the appropriate use of vaccinations and following simply biosecurity measures. Health monitoring, pre-movement and isolation monitoring post-movement can minimize the risk of large-scale infectious disease outbreaks occurring. When disease outbreaks are suspected, rapid testing and isolation of cases alongside implementation of other biosecurity measures can minimize the spread. A collaborative approach between yard managers, owners and vets will facilitate the early identification of infectious diseases outbreak.